Dr. Winnie Moses, Medical Director at Parfair Medical Aesthetics in Pasadena. So each age group, they have their own conditions. So in the younger generation is really are aging probably starting around 25. Initially we see our face is mostly oily. So in our early 20s we have a lot of concern of acne because the oil gland get clogged up. And then from 25 we start noticing sun damage, which is brown, yellow, dark spots.
I do have a little bit of that.
Yeah,
sure do.
yeah, especially in California. In LA, it's just strong. Without using sunblock, that's definitely going to show up even earlier.
Yeah.
And then lots of people come in because their skin pore is so large. I mean, just staring at you when you're looking in the mirror. So those are a few common concerns in the age group of the 20 younger generation. So we typically approach it based on the condition, and we'll do a consult, address the each layer of problem of the skin where that condition happened. So such as, somebody has clogged the pore, so we recommend exfoliate, and also recommend some medical grade skincare like retin-A, vitamin C. Those are all very important ingredients in your daily skincare regimen. The reason retinol and vitamin C, they basically help your cell turn around. So you typically get your fresh skin cell every 25 to 30 days, and this will accelerate that process. So you're constantly getting fresh skin. In addition, to the pigments, which is really not just on the superficial, they're deep. So we probably try all sorts of over-the-counter medication, the skincare products, try to get rid of them. Nothing really works significantly. So at Parfair, we do one signature treatment, which is very well known. It's called Umecta, or clear skin treatment. It's just one treatment or two treatment will get rid of those pigments just within a few days. Yeah. So the pigment will get darker within the first few days and then just fall off.
And what about like pimples? So I know there's like hormonal pimples, which are the kind of deeper ones.
Yeah.
And then there's other pimples that are just caused by like dirty faces.
Yeah.
So what do you suggest to take care of both of those?
Pimple, of course, because we have more oil gland in the 20s. So in addition to the home care skincare products, Silk Peel, which is an advanced microdermabrasion, is really effective for pimples, active pimples. It's basically diamond tip. It just exfoliates, not just superficial, and it goes to the first and second layer because some pimples are deeper. So it's really get rid of that oil gland and exfoliate. Meantime, get some medical grade skincare serum into it.
I heard that there was also something that you could inject into the pimple to get rid of like the deeper ones.
Oh, absolutely.
What was that?
Kenalog injection. It's very easy, it's quick and easy, minimum pain. So basically it's a steroid injection. So once you inject a tiny little amount right into the pimple, some people notice within 1 day or two that pimple just, flattening.
So what about like at home every day? What are some steps that people could take to, combat pimples ever popping up? And what are some ingredients in lotions and stuff that you think would be good for pores or pimples or any of the above?
Yeah, great question. There's so many skincare products on the market right now. It can be very confusing to look for what we are looking for our skin. So because our skin made of all this different component, when we apply skincare product, we really need to address what's our basic need. Number one, it's very important, is hyaluronic acid. So moisturizer, you're looking for whether or not they have good component ingredient of hyaluronic acid. Another important factor is peptide.
Peptide?
Yes. So you probably see some very expensive skincare products have 1 or 2 peptide. in there. What's peptide? They're basically building block for collagen.
Oh.
Yes, so they're smaller protein. When they gather together, they build collagen. So even though age start in the mid-20, our collagen just degrade and face become a little bit hollow. The most early signs, under eye
Oh yeah,
bag.
under eye bags, my god.
Yeah, that's due to, collagen loss. So that's why peptide is a very important ingredient to supply to your skin so they can make some building block for your collagen. And then another ingredient will be important, as we mentioned, is retinol or retin-A. And they are almost like a home skin resurfacer. So instead of just keep doing the chemical peel or mechanical peel of your skin, you just apply some retinol and they're going to help your cell turn around. Yeah, the best retinol is really something you can tolerate and use every day. So over-the-counter retinol has very, very low percentage. And most retinol is in the doctor's office. Sometimes you need a prescription, but we do have all different percentage here ready to use. So start with a lower percent and train your skin to tolerate that and gradually build into your daily regimen.
Some of your skincare questions. I'm not showing my face right now because I just got a selfie and it's kind of red, but ta-da! Anything you would like to say to our lovely viewers?
If you want to come in for a treatment, just give us a call.
I will put the information right here.
Yeah, and also book appointment. We'll do a free skin consultation here.
Yay! Learn more about your skin. Woohoo! Bye guys, see you next week.